sensitivity, it's important to cover all of your bases and look back to what's creating a problem more than anything. Because usually with somebody with heavy metal toxicity, they have a low detoxification component anyway, so they're struggling, so they can be genetically weak in that area. So we try to take the stress off as much as possible and really help to support them in what you're looking for. Now there are different types of testing available, which Dr. Boer is going to talk about. The main ones that I looked at here were from hair analysis, but urine is always a secondary test for finding out what type of heavy metals there are. The problem with many of these is hair can be contaminated. Aluminum can be from the scissors. You use scissors to cut the hair instead of pulling it out. A lot of ladies tend to do more dyeing of the hair than men do, but a lot of the products that we use to either dye or permanent solutions for the hair will strip the hair of necessary minerals that would be in there. So like lead poisoning, a lot of times you'll look at your zinc levels as well as your magnesium levels in the hair to see what type, the extent of the lead poisoning is. You can't tell that if we have already used those products because they tend to strip the hair. Okay?
On arsenic, I'm recalling a patient a decade ago. He was a CEO of probably a firm that all of you would know. It's a very big international name with headquarters here locally. And this fella came in with severe Alzheimer's, was 53 years of age and could not even speak. Needed a constant companion, could not drive, had totally lost everything he had. Was head of the company in name only, his sons were running it, and even needed help putting his own clothes on. And I'm going into the history of trying to figure out what happened here. And we just could not figure it out simply because he could not communicate and his wife was the only one that could do it. So we ran a hair analysis on this fella and arsenic was through the roof. And so we started questioning him more closely and it appeared that his symptoms had come on about a year after he had totally redone all of his wood decking around his house. Apparently it was a massive project. This was very much a handyman. Hand did all of it. It was the preserved kind of wood. Had obviously gotten exposed to all the wood dust, the arsenic, and that it poisoned him. His detoxification pathways were not working. And it fell this very high-powered mind CEO who, in his name, still has 3 polo farms in this area. And there's nothing left. It's just a shell of his former self. And the damage at that point was already done because it had been several years. And at that point, we could only help him physically, not bring his brain back. So it's incredible how these poisons are around us and have a huge impact on some of us. So it's almost kind of scary, and I've never looked at wood quite the same since, as you would imagine. Yeah. Sorry to interrupt.
No, we as consumers have become much more savvy on these things because it's more of your old treated wood now that has more arsenic in it. We just picked up treated wood posts the other day, and they all say no arsenic in, but you still have to, if you're doing older projects and things like that, protect yourself.
Yeah.
All right. Moving on to metals testing for this bit. Touch a little on the hair, we'll let you cover the rest.
Hair is really, was very controversial at one point because it was so inaccurate and so many discrepancies from lab to lab, and therefore that was a perfect segue for the medical profession to make fun of metal testing. They said blood is the only thing because, you know, blood is the holy anointed oil to do all our testing on. And if you can't find any blood, it's nowhere. Well, we know that to be not true at all, because blood is only good for current exposure. We had a gal who was exposed to mercury gas 2 years ago, a nurse who was carrying mercury in a vial of all places. There is some uses medically yet for some instrumentation. It fell on the floor, immediately scattered all over, had mercury gases exposed to her, and had mercury poisoning. Came to my office immediately that day. I put her on protocol to protect her and told her to get blood work immediately because blood will measure current exposure. It's very good for what's happened in the last month. And it showed sky-high mercury. Luckily, we were able to be right there, bind it. Luckily, just with vitamin C, believe it or not. Ultra-potent C will bind current exposure. And she's fine today. She does not have residual mercury except what's considered normal at this point. So blood is really good for heavy metals that are current, so you can also measure eating a lot of salmon, for instance, from Lake Michigan. How is it affecting you? And blood will do that. Hair is really the best for long-term use because as we are exposed to heavy metals, we store it in our bones, in our brain, in the soft tissues, especially fat. That's why it likes to go to the brain because it's 70% fat, brain is. And hair, isn't it? Because these metals just slowly leach out, because we do have detoxification pathways that pushes out mercury, pushes out lead. It might be minuscule, but it's there. It pushes it out into the nails as well as the hair. So therefore, we can have a pretty good measurement of the whole spectrum. That's what we like it for. If we need an overview of all heavy metals, we use hair. Quantity-wise though, it's not real great. There's a lot of variables there depending on your detoxification pathways. And if your body's able to push it out faster, then it's going to show up more in your hair. Does that make sense? Mm-hmm. But it sure is good to have an overall picture sometimes. Stool analysis is really fallen by the wayside. Some doctors are still doing it. That's the only reason I mention it. It is highly unreliable and really not to be used. But it is one of the methods that we've used in the past. Urine has really come out as the king. If you look at all the research institutions, including in this country, we are using urine because it is by far the most accurate. Its downfall, and by the way, this has been in use since 1938, so we really have a long track record with this. And like anything else, they kind of fell in and out of favor. But it's always remained consistent, very accurate. Not many what we call false positives. In other words, if it scores, you've got it. And the only downfall with it is the urine analysis that we utilize. We can test for 11 different metals, but only the top ones will show. So if lead shows up, well, maybe there's mercury that's number 3 down the line, and that one will not show. So you work on the lead, and you get that out of the way, you retest the urine. There's another one that I didn't know about. So sometimes a hair analysis is nice, because then at least you got the whole picture. But the urine analysis is affordable. It's less than 40 bucks to do and very accurate. And it also shows us if our current therapy is working, because we've got a baseline. You institute therapy, which we're going to show you right away. And if it shows increased mercury content, that means we're pushing it out. Yes, it's working. Yeah, or you got to try something different, because no patient is the same. And therefore, sometimes what works for one doesn't work for another. Any questions on the heavy metals as far as testing? So,
how accurate is the urine test?
The urine test is accurate than 1%.
Oh.
Yeah, and it's reproducible from time to time to time to time. Yeah, the only time that is not accurate is operator error. But we're not quite doing it right.
Not a big enough sample.
Yes. So, heavy metal detoxification. DMPS, DMSA, calcium EDTA, sodium EPTA. These are the ones that are most commonly used and approved by the FDA. They have their strengths, they have their weaknesses. They all push out the heavy metals. But all of them have problems. They have side effects. They are expensive, time-consuming, and for example, the DMPS. I like that one to give you a shot with it, DMPS, because it pushes things out and then you can measure things in the urine. There's more elegant ways of doing it, but it's good for that. However, it also, if you use it as a chelating agent, you need about 30 chelation treatments of this. It strips your body of some very important trace minerals. Copper, sodium, calcium, and it leaves the patient weak. And just the whole enzymatic system of life in disarray. And I've seen patients not quite come back from that. I don't really care for these systems. And back on my old home territory, the Netherlands, this has fallen out of favor about 2 decades ago. Here it still gets pushed pretty hard. Not quite sure why, because there's much more elegant ways of doing it, but these are the ones that are being used. I was at a very interesting 3-day conference in heavy metals a while ago in Florida, and this was a really neat conference because it was international, but for once USA was really represent it very well. It seems like we're doing a good job with